Teeth reconstruction, including tooth restoration and dental implants, are common procedures in modern dentistry aimed at restoring the function and aesthetics of the teeth. Here's an overview of each. Tooth restoration. Tooth restoration involves repairing damaged or decayed teeth using various techniques and materials. Some common methods include dental fillings. Used to fill cavities caused by decay, dental fillings can be made from materials like amalgam, metallic, or composite resin tooth-colored. Dental crowns. Crowns are tooth-shaped caps that cover damaged or weakened teeth, restoring their shape, size, strength, and appearance. They can be made from various materials such as porcelain, metal, or a combination of both. Dental bridges. Bridges are used to replace one or more missing teeth by anchoring artificial teeth, pontics, to adjacent natural teeth or dental implants. Dental implants. Dental implants are a more permanent solution for replacing missing teeth. They consist of three main components. Implant fixture. A titanium screw surgically placed into the jawbone, acting as an artificial tooth root. Abutment. A connector piece that attaches to the implant fixture and holds the prosthetic tooth or dental crown. Prosthetic tooth. A custom-made dental crown, bridge, or denture attached to the abutment, providing a natural-looking replacement tooth or teeth. Dental implants offer several advantages over traditional tooth replacement options. Stability and durability. Implants are securely anchored in the jawbone, providing stability similar to natural teeth. Preservation of jawbone. Implants stimulate the jawbone, helping to prevent bone loss and maintaining facial structure. Improved oral health. Unlike dental bridges, which may require adjacent teeth to be altered, implants don't rely on neighboring teeth for support, preserving dental health. Enhanced aesthetics and function. Implants look and function like natural teeth, allowing for improved speech, chewing, and smile aesthetics. Both tooth restoration and dental implants require careful evaluation and planning by a qualified dentist or oral surgeon. The suitability of each option depends on factors such as the patient's oral health, bone density, and personal preferences. It's essential to consult with a dental professional to determine the most appropriate treatment plan for individual needs.